Welcome to the coronavirus update offered by Freer ISD Department of Health Services. Coronaviruses are a common cause of colds and upper respiratory infections. The new coronavirus, also referred to as COVID-19, continues to be another coronavirus that causes a cold-like illness that may cause a lower respiratory infection. COVID-19, short for Coronavirus Disease 2019, is the official name given by the World Health Organization to the disease caused by this newly identified coronavirus. How is it spread? It is spread mainly from person to person, between people who are in close contact with one another within 3 to 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouth or nose of people who are nearby or possibly be inhaled into the lungs. Transmission from infected surfaces or objects. It may be possible that a person could get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not the main way the virus spreads. As per the City of Laredo Health Department on March 4, 2020, there is no local transmission in Texas, San Antonio, or Laredo. All the cases in San Antonio were travel-related or from the Diamond cruise ship. They are not cases from San Antonio. Most persons exposed to the virus recover well. Over 80% have mild symptoms or do not have any symptoms. It is those vulnerable populations such as the elderly, children under 5 years, those with underlying conditions, pregnant women, and those with special needs that are most at risk for potential complications. At some point, the COVID-19 will be worldwide, in the United States and in our communities, but based on what is known, it will be another coronavirus. There is currently no vaccine to protect against COVID-19. The best way to prevent infection is to avoid being exposed to the virus that causes it. Stopping transmission of the virus through everyday practices is the best way to keep people healthy. At this time, COVID-19 continues to cause a cold-like respiratory infection, fever, cough, and possibly shortness of breath. Symptoms may appear within 2 to 14 days after exposure. May exhibit lower respiratory symptoms such as bronchitis or pneumonia. Prevention. Report any Chinese travel history within 14 days of travel to mainland China for persons with cold-like and respiratory symptoms. Follow general respiratory precautions. General respiratory precautions. Wash your hands often and correctly. Cough into your elbow. Cover your mouth when coughing or sneezing. Do not touch mouth, eyes, and nose without washing hands. Regardless of previous flu illness, get vaccinated against the 2019-2020 flu, and those over 65 years of age should get the pneumonia vaccine as well. If you are sick, stay home and call your doctor. Prevention of COVID-19 as well as other coronaviruses and influenza, also the flu. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth without washing your hands first. Stay home when you are sick. Cover your cough or sneezes with a tissue. Cough into your elbow. Then throw the tissue in the trash. Wash your hands. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Wash your hands often with soap and water. As per the City of Laredo Health Department, there are no plans for school closings or canceling of public gatherings. As per the CDC guidelines for school districts to follow, these are the following procedures. Develop information sharing systems with partners. We do currently partner with the City of Laredo Health Department. We also do get updates from the Christus Spawn for your clinic. We are to monitor and plan for absenteeism. We have daily notifications of illnesses with our campus nurses. You are to establish procedures for students and staff who are sick at school. Any students or staff that are symptomatic or have fever need to go home. We are currently working on a re-entry procedure for students and staff that have been out due to illness who will need to recheck with the nurse prior to entering the school. Perform routine environmental cleanings. Aramark is notified of any type of illnesses that we have throughout the district. Create communication plans for use with the school community. Currently, we have notes home at NTE. We have information posted on the website. We send messages through School Messenger and through Facebook. What we know about COVID-19. At this time, it is acting like another cold virus. There is no local transmission of the COVID-19. Over 80% of COVID-19 have mild symptoms or none at all and recover. We will most likely have more cases in the United States and in Texas. We are following CDC guidance and also the guidance of the City of Laredo Health Department. We will continue to closely monitor the situation. If you have any questions or any concerns, please contact me, Mary Alice Canthu, Director of Health Services. I can be reached at 361-394-6025, extension 181. Thank you.